Hi, my name is Courtney Wu, and I am a registered dietitian. Today, I will be presenting the research proposal for the effect of probiotic supplementation on glycemic measures in adult individuals with type 2 diabetes. Before we begin, I will review the agenda of today's presentation. We'll first begin with an introduction of the topic, a statement of my research question, the literature review, and then the methodology and limitations of the proposed study, as well as the impact that this research question has on the dietetic profession. The prevalence of type 2 diabetes has increased rapidly, and the International Diabetes Federation reports 415 million adults have diabetes, which includes type 1 and type 2 diabetes. This number is estimated to increase by 642 million by the year 2040. This is significant because the increase in prevalence of diabetes also means an increase in healthcare costs for diabetes. The healthcare expenses for people with diabetes are 2 times higher than for those who do not have diabetes. Currently, type 2 diabetes accounts for about 85 to 95% of cases of diabetes, and it also requires a variety of risk reduction strategies. Some of these include dietary interventions, medication, and more recently, the potential for modulation of the gut microbiome. There's strong evidence that supports a correlation between type 2 diabetes and the gut microbiome. As researchers have found, there is an association of compositional changes of the intestinal microbiome in those affected with type 2 diabetes versus those who do not have the disease. Therefore, research of probiotics and symbiotics in the prevention and treatment of metabolic disorders such as type 2 diabetes has dramatically increased, and this provides a potential role for probiotics in the treatment and management of type 2 diabetes. The question today is, does supplementation of a multi-strain probiotic improve glycemic measures such as fasting blood glucose and glycated hemoglobin in adult individuals with type 2 diabetes mellitus? The hypothesis we are seeking to prove today is that probiotic supplementation will improve glycemic measures of fasting blood glucose and hemoglobin A1C in adult individuals with type 2 diabetes compared with supplementation of placebo. In regards to the literature review, a systematic review of randomized controlled trials by Saiz Lara and Bosama et al. Had found that the supplementation of probiotics had significantly different results as far as fasting blood glucose and due to the supplementation of the probiotic. Randomized control studies using fermented milk by Tanucci et al. And Ostradahimi et al. Over a 6-week period and 8-week period respectively found that there was a significant reduction in hemoglobin A1C and then a significant difference between A1C levels of the intervention group versus the control group. And lastly, as far as randomized control trials using encapsulated forms of probiotics, Ibrahimi et al. And Feruzzi et al. With conducted randomized control studies over 9 weeks and 12 weeks respectively, found that supplementation significantly decreased fasting blood glucose and hemoglobin A1C. So the methodology for the proposed study is a randomized control trial, double-blind parallel study. The duration of the study is 12 weeks, and the intervention in question is a daily supplementation of a multi-strain probiotic of Lactobacillus acidophilus and Bifidobacterium, as these are the most commonly used forms of probiotic in the studies. Participants will be recruited by phone and in person at the UCLA Gonda Diabetes Center, and this study will be submitted for IRB approval and the approval of the Diabetes Center Ethics Committee. For the sample size, a G-Power a priori independent means t-test was conducted using a medium effect size and a power of 90. And the power was chosen because the majority of studies was using a 80 for the power. The sample size that was found was 140, and due to 20% attrition rate, the sample size was increased to 168. So for the inclusion of participants, these participants will have type 2 diabetes as diagnosed by the definition of American Diabetes Association. Their age is 30 to 70, and they have signed the informed consent. Exclusion criteria include probiotic use within the past 3 months, antibiotic therapy, insulin therapy, and current smokers and alcohol abuse. Statistical analyses used will primarily measure the pre- and post-test of the interventions. Primary measurements in question include the fasting blood glucose and hemoglobin A1C measures from baseline and conclusion. Secondary measurements also include height and weight and BMI, again at baseline and conclusion, and an additional review of the 3-day 24-hour dietary food recall will also be used. The tests conducted will be the independent t-test and the paired t-tests. Some limitations of the study will be the length of the intervention, as it would be ideal to conduct a more long-term study. The sample size is also a limitation because it is fairly small. And a reporter bias regarding the food recall may also be a limitation as well. And there is no control for the study for the dietary intake of probiotics. So the impact on the dietetic profession, the gut microbiome, as I mentioned earlier, is involved in the metabolic disease manifestation. Therefore, it is a good venue to explore the potential alternative or supplemental form of treatment using the probiotics. This form of intervention and treatment is also non-invasive and fairly low risk, so it would help improve the quality of life of those who are affected with the metabolic disorder. I thank you for your time and for your attention.